7:14 now, Saturday morning. When was the last time you thought about your heart health? February, good time to do it because it's National Heart Disease Awareness Month. In fact, it's the perfect time to pay a little more attention to those factors that can trigger heart attacks. And here to talk about some of those things to watch for, Dr. Manuel Poon of Prime Connecticut Heart and Vascular Center in Bridgeport. Thanks for being here. We appreciate it.
Thank you for having me.
A couple of weeks ago we did the Go Red for Women talking about heart health. And this is one of those things that you do talk about men and women with different types of symptoms. And that must be a good first step, is to know how to recognize this.
That's correct. Women usually do not have as many symptoms as men. They're more subtle. They can complain of being short of breath, fatigue, insomnia, and their symptoms may be different than men.
And we hear so many times that women feel these shortness of breath, fatigue, and just think this is regular day-to-day life. How do they know? When should they say, maybe this is something else, maybe I should see a doctor?
Usually if it happens abruptly, that's one of the signs that you should be aware of. And also you have to have risk factors that promote heart disease. If somebody doesn't have diabetes, hypertension, if somebody's a healthy young woman, they usually do not have to worry about it.
Yeah, so that's why knowing your family history is so important.
That's right.
As well.
As well as family history.
There is some kind of a new procedure that is being done here, and we have some video of this. If we could put that up, and maybe you can kind of lead us through this and tell us a little about what we're looking at here.
This procedure is called EECP, and it stands for Enhanced Extracorporeal Counterpulsation.
Okay.
And
which means what?
Which means that it is an external method of pushing the blood from your legs into your heart. And it is triggered by your own heartbeat. And what it does is it pushes the blood from the leg, the pelvis, into the heart, and it restores the blood flow into the blocked arteries.
Gets things moving again.
Gets things moving again.
Yep.
And initially we thought that it was just a mechanical type of process, but actually there's been studies where they have shown that actually with the pressure that you exert on the arteries, there are chemicals and hormonal changes that happen because of this that promote healthy blood vessels. How
does this work? How do you push that blood from the legs up into the heart?
What it does is you have 3 sets of inflatable cuffs. They look like blood pressure cuffs that are big.
So it's just squeezing?
Yeah, squeezing, and it is comfortable.
Yeah.
But the patient has to stay in this bed for about an hour.
And you're just kind of helping nature do what it should do.
Because it promotes natural hormones and chemicals that promote healthy blood vessels. All
right, we talked a little about symptoms, we talked a little about treatment. What about prevention? Obviously, exercise, eating well. Help us out with diet. So what are some of the healthy heart diet tips you can give us?
Well, there are some diets like the DASH diet that is actually used for hypertension.
Yep.
But they all basically are the same as the Mediterranean diet. And what it is that you want to eat vegetables and fruits, fish, at least two servings of fish a week, and avoid a lot of the fatty meats and a lot of fiber too.
Yeah, and then the simple things we saw on the screen there as well. Exercise, and it doesn't take a lot. You just need to be active, right? That's the big thing here. And not smoking is a helpful tip here as well.
That's right. In fact, one of the things about this machine that I think is almost a passive form of exercise. And we have had patients that couldn't walk from here to that camera. And by doing this, by taking their angina away, we have started a passive exercise, and it's a segue to do
just opens the door.
Exercise. Yes.
Very good. Dr. Manuel Poon, we appreciate you being here.
Thank you
the tips,
so much.
the information on our website at WTNH.com. As always, the Good Morning Connecticut weekend section of the site. We'll have it there for you. It's a good time to think about it. It's February. If you haven't done that, now you can think about it.